All right, now Bruce, we were talking to Stephen Porges, and you had a question about modern day
Real-world
current
interventions,
application.
right.
Current application. How does the theory either explain some of the things we already do, or are there new applications coming? Go ahead, Dr. Porges.
Oh, you were going to ask me about stellate ganglion blockade.
Let's start with that. Let's start with that. There's an article that came out that was in New York Times.
Wall Street Journal, my favorite medical one.
Talking about using stellate. So there are ganglia along your spinal column that help regulate the sympathetic nervous system, which is the adrenaline sort of system, the stimulating system. And the stellate ganglion is a big ganglion up in the neck here, and they
stick a needle away.
They can destroy it, and by destroying it, they think they may be helping with some of this overdrive of the sympathetic system that's associated with post-traumatic stress disorder.
Yeah. So a person I know very well, Eugene Lipoff, is really one of the innovators of that technology. And it's a temporary blockade, so it's an injection and it's lateralized. So remember, we're lateralized individuals. We have both left and right ganglia, and he does it on the right side. I think I got to be careful. I don't want to.
I'm sure.
But
I'm sure it's the right.
Yeah, there's a real. Anyway, what his model, and I think there's great viability in it, is that he downregulates the sympathetic temporarily, and that enables the emergence of a more regulated system. Now, he thinks what's happened is that neural growth factor has created, the term I used was an expanded sympathetic nervous system, that due to the chronic effect of mobilization following the trauma. Now, remember, when people shut down, one of the most adaptive behaviors is to keep moving, and you see this in your addiction population, that when people have traumatic experiences, they often will do high-risk behaviors and keep moving, because the worst thing for them is to be still, and they can't sit still. So the blockade seems to change that. They seem to be able to temporarily, I shouldn't say temporarily, immediately after the blockade, stabilize, and then this seems to last longer than the effect of the blockade. So it's like if I take this interference away for a while, my nervous system will spontaneously reorganize itself. Now that's my conceptualization of it. In the research projects, they've done extraordinarily well in terms of clinical symptoms. They have not done the research on does the autonomic nervous system, is it retuned after the blockade? And that was the question I was most interested in finding the answer.
Interestingly, I have a complex trauma patient who did have this procedure done by Dr. Lipoff.
And how'd it go?
And describes it as life-changing and permanent. And this person had terrible chronic nightmares that ceased immediately after this procedure, and was just telling me about Dr. Lipoff's work recently.
That's fascinating.
Now, what he also has told me, that he actually goes into a different ganglia through a different cervical level if it doesn't take on the stellate. So he actually has a follow-up, and when he does it, he gets really high percentages of effects.
Huh.
Amazing, huh?
Yeah, it is amazing.
But you see, it's amazing. But if you see it in terms of a technique to retune the autonomic nervous system that got stuck in a position.
Oh, it makes sense. It makes sense. But they do these blocks for hyperhidrosis too. They do it for hand.
Yeah. Right.
And those patients complain of dysregulation.
Well,
there's all these websites dedicated to them feeling out of their body and not feeling right and having sweating here and there and pain here. And so I guess at least one message is there needs to be some anticipatory sort of psychotherapeutic kinds of management.
Maybe the way you were, Dr. Porges, the way you were talking about this, it sounds like the way of thinking about it is almost like the keeping moving is like trying to outrun the tiger, and that if you stop, it will catch up with you.
And by the way, a lot of ADD kids have a trauma history, and it makes me think, I wonder if this is going to be a treatment for ADD one day.
But this is like a reset. It seems like it stops the vicious cycle and gives an opportunity for the body to reset and
Yeah.
catch up somehow.
Cheryl, I think you're absolutely right, because it's kind of like respecting the wisdom of the body if we can turn off this system. And it's partially turning it off because it's lateralized, and it's a partial, it's not a permanent blockade. So its effect, I guess, is for a few days or maybe a week.
They can
really.
clip it and block it permanently too. But are you?
They must
doing-
not want to.
Yeah, I don't know